speech and language evaluation for fluency for a student who is bilingual, there are a few things that we need to take into account that are different than when we're doing this process for a monolingual student. So when we are evaluating bilingual students for fluency, we always want to remember that there's no evidence that speaking two languages causes stuttering, though there are a number of differences in the research between bilinguals and monolinguals. One study that I think really highlights our need for this information is one that was done by Dr. Courtney Bird. She asked speech pathologists to evaluate one bilingual child who was a person who stutters and one bilingual child who was not a person who stutters. 10 out of 14 of those speech pathologists correctly identified the person who stuttered as a person who stutters. Only 2 out of 14 correctly identified the person who did not stutter as a person who does not stutter. So this really speaks to the risk of over-identification of bilinguals if we don't have the right information in our hands. So let's talk about some of the research really quickly. Dr. Lisa Bador and her colleagues found that bilinguals had many more mazes than monolinguals. Those mazes included things like interjections, sound repetitions, phrase repetitions. Christine Fiestas and her colleagues found that bilinguals in their study had twice as many repetitions than their monolingual peers. Those repetitions included sound repetitions, part word repetitions, whole word repetitions, and phrase repetitions. So you can see that these increased disfluencies that we're seeing fall into both of the categories that we usually use, stuttering-like disfluencies and non-stuttering-like disfluencies. So we can't use that necessarily to differentiate these. Another study by Carius and Ingram found that their bilinguals had a 37% disfluency rate compared to their monolinguals who had a 3% disfluency rate. And Dr. Bird found a similar pattern of disfluency rates in her study of bilinguals compared to monolinguals. So she found about a range of 3 to 22% of disfluencies in their bilingual population. So studies show us that bilinguals in many cases produce more disfluencies than their monolingual peers. So we want to be careful that we are not using the monolingual guidelines to evaluate and make decisions about bilingual students. Then there's the question of why. Why would bilinguals produce more disfluencies than their monolingual peers? Well, there's this idea of linguistic uncertainty expected by a bilingual child who's navigating between phonological systems, lexical systems, making semantic decisions, and doing this all across two languages. So the idea is that this uncertainty can result in increased disfluencies. It's also been noted that a higher level of disfluencies can occur when a child is switching between languages, when they're having difficulty finding the correct word, and also when they're having difficulty using grammatically complex sentences. So overall, we want to be very sure that we are not using monolingual guidelines when we are making diagnostic decisions about bilingual students, because if we do, we are at risk for over-identifying our bilingual students for services that they really may not need. So how can we differentiate between those who are people who stutter from those who aren't? Well, we want to look for exhibiting stuttering-like behavior in both languages. We cannot use the specific types of disfluencies alone. We're going to need to use additional information. Parent concern has been found to be a critical component. Some of the things that parents often note are timing and tension differences. Dr. Bird and her colleagues found that atypical tension and atypical rhythm were not present in the frequent disfluencies produced by the Spanish and English bilingual children in their study. So that's an important piece that we can look to, is that those secondary characteristics, the facial grimacing, the eye blinking, the hand movements, and things like that, those are the things that can really help us differentiate the students who stutter from those who don't. So to recap, we know that Some bilinguals exhibit higher levels of disfluencies than their monolingual peers. Some of those are stuttering-like disfluencies. Some of those are not stuttering-like disfluencies. So what we want to do is look to some of the other things like parent concern, secondary characteristics, whether things exist in both languages or not, to help us make a more confident diagnostic decision.